Diet and exercise are the building blocks of good health, yet more than 78 million American adults are obese. Every day it seems like there's a different diet trend, and what's good today might be bad tomorrow. But how much truth is in these internet sensations? Dr. Nagi Kumar joins us to share her words of wisdom when it comes to nutrition and to take your questions live as part of Moffitt's Ask the Experts Facebook Live series. Does soy cause breast cancer? What about microwave popcorn or processed meats? And what exactly is coconut oil pulling? Let's find out now as Dr. Nagi Kumar joins us for Facebook Live Ask the Experts. Welcome to Moffitt Cancer Center's Facebook Live Ask the Experts series. Today we're talking about nutrition. What should we eat and what should we avoid in order to stay healthy? I'm joined by Dr. Nagi Kumar. She is the Cancer Chemoprevention Director and a researcher here at Moffitt Cancer Center. She's also a registered dietitian and a fellow of the American Academy of Nutrition and Dietetics. She's going to tell us how we can stay healthy and fit. She'll set the record straight on cancer-causing foods and foods that supposedly cure cancer. Plus, she'll let us know how we can make our food interesting, delicious, and nutritious. But most importantly, right now, we want to hear from you. Dr. Kumar is answering your questions live, so be sure to submit them in the comment section below. Keep in mind, Dr. Kumar cannot offer personal medical advice or make a diagnosis via Facebook. For that, please call 1-888-MOFFIT or visit moffitt.org to make an appointment. Please note that the Ask the Experts Health Series is a general health and wellness discussion and is not meant to provide medical diagnoses, treatments, or to replace medical care. For that, please refer to your primary care provider for personal health treatment options. Thank you so much for joining us today, Dr. Kumar.
Thank you for having me.
And as we mentioned earlier, about 78 million Americans are obese, and according to the National Cancer Institute, being overweight and obese is often a risk factor for cancer. Can you tell us how weight factors into cancer risk?
So in our research, we have seen that obesity and being heavier than what you ought to be contributes not only to cancer but other chronic diseases also. We know some of the mechanisms are, number one, genetically, someone is predisposed to being obese, but we also find that obesity contributes to a lot of metabolic changes. And number one, through changing the endocrine system or the hormonal system, it changes, it puts the hormones into a chaotic environment, and that can trigger cancers. The other way by which obesity contributes to cancer is by increasing chronic inflammation, and that has been a major contributor to cancer too. So these are the two pathways we think are important as to act as triggers that are contributory to higher risk of cancer and also other diseases.
Perfect. And we are taking your questions live, and we have our first Facebook question. This one comes to us from Adela. Adela wants to know if there's a good way to stop cravings for carbohydrates such as bread and cake.
Oh, wow. That's a difficult question. I would say if you're craving every day for cake and bread, that's a problem, but if you're craving for it only once in a way, just go ahead and have that piece of cake or the piece of bread. I don't think, I call this the 80-20 rule. 80% of the time, be good, and the 20% of the time where you're craving for specific foods, go ahead and meet that need and get over it and move on.
And we all know that famous saying, an apple a day keeps the doctor away. Why are fruits and vegetables so key to good health?
We are finding out that there are about 80 fruits or vegetables that we eat on a daily basis or could be eating on a daily basis that have these substances called phytochemicals or plant chemicals that have a very important role in interfering with the pathways towards cancer-causing pathways, or what we call the carcinogenesis pathways. And we know that combinations of these fruits and vegetables, the redder, the greener, the purpler, the more orange your fruit and green your intake is on your plate, the greater protection from cancers as well as other consequences of bad eating habits.
And speaking of fruits and vegetables, our Facebook friend Sarah wants to know if there's a difference in nutritional value between fresh, frozen, and canned vegetables. And she's also wondering if certain methods of cooking these vegetables impact their nutritional value.
Absolutely. The fresher it is, the closer you are to the source of these vegetables and fruits. And we live in Florida. So Florida, California, and Texas probably are the closest to their source of fruits and vegetables. So the fresher the fruits and vegetables, the highest amount of nutritive value that you can obtain from them. The second line is flash frozen. Flash frozen foods by a very good company can retain most of the nutrients. But there's a loss of about 10 or 15% of the original nutritional value of these fruits and vegetables. Last but not least is your canned fruits and vegetables. But we're getting better at it. We are getting better at even canning. Some fruits vegetables like tomato, the tomato sauce that you get in a bottle or a can has a higher nutritive value than the tomato itself because it's more concentrated. And so the antioxidants and other nutrients that are present in tomatoes are concentrated in a bottle. So depending on what you're eating, it's important to get the freshest possible, fruits and vegetables possible, cook it the least, just for safety, wash it well, and then that has the highest content.
And we have another Facebook question. This one is from Donna. Donna is wondering, what are the benefits of eating moringa, purslane, and Malabar spinach?
Well, these are all green vegetables. So they're all good. They all contain what we call these favorable phytochemicals or plant chemicals. And again, green leafy vegetables and other vegetables that you mentioned are all from the green bucket. And they're all excellent. They are potent antioxidants, and some of them may also have anti-inflammatory properties. So these are the things we are looking for to interfere in the carcinogenesis pathway or cancer-causing pathways and can stop it or reverse it. And that's what we're looking for.
Interesting. And every day it seems like there is another trend making its way around social media saying this food causes cancer or certain foods may even cure cancer. Are there really any foods that can cure cancer or protect us from getting cancer?
I think what we've seen in our research and the research that's going on around the world is that there are several of these nutrients that can prevent cancer, but we don't know a magic bullet, even by way of nutrition, that can cure the disease. But if we can, prevent it from the early stages or reverse it from progressing to later stages of cancer, I think we are doing a great job of preventing most of the cancers.
And just a reminder, Dr. Kumar is taking your nutrition questions live. And we have another question from our Facebook friend, Jason. He wants to know, how much truth is there in so-called superfoods?
Superfoods are superfoods. And I've been talking a lot about these phytochemicals, the green, yellow, the blueberries, the strawberries, the oranges, and anything that's colored, that's vividly colored and comes under the group of fruits and vegetables are superfoods. Mango is what I call a superfruit. It probably has the highest amount of anti-inflammatory, antioxidant properties. And then there's blueberries, there's strawberries. So those are all superfoods. And fruits and vegetables have consistently shown to be the superfoods in preventing not only cancer, but other chronic diseases.
And we have another Facebook question. This one is from Jeremy. Jeremy says everything seems to be organic these days, and he's wondering if there's anything he should be looking for on the packaging of these foods.
So you have either organically grown fruits and vegetables and whole grain, organic livestock, organic chicken, organic eggs. The United States Department of Agriculture has very strict regulations on what can be labeled organic and what cannot be labeled organic. So the fresh fruits and vegetables that you intake as you buy them can be wholly organic, but then there are some prepared foods that can also be organic, but only a part of it is organic. So yes, organic is great because they are grown without antibiotics. These animals are fed natural fodder. The farming is done in a very responsible way. So they definitely have higher nutritional value, especially the antioxidants and anti-inflammatories that we've been talking about from naturally occurring fruits and vegetables, but also in livestock and in cattle. If they are grown grass-fed or alpha sprouts fed, these animals have a higher content of what we call omega-3 fatty acids. And these omega-3 fatty acids are also potent anti-inflammatory agents that we are working with in our studies to look at whether this can reverse chemobrain, which patients who on chemotherapy get, or can it reverse cachexia, which is a syndrome that cancer patients get where they lose muscle and fat. So we are intervening in these populations with these kind of foods that are organic, that are grown responsibly, and to see whether high concentrations of them can actually act as medicine.
And speaking of therapy and medicine, our Facebook friend Daniel wants to know, do you use ketogenic meal plans as an adjunct therapy for cancer?
Not yet. I think there's a lot of work that has been done in animals, and it's actually been done at the University of South Florida. And we are looking at ketogenic diets targeting early stages of brain tumors, like early stage or low-grade gliomas. It looks like ketogenic diets are really high-fat, high-protein diets with a very low carbohydrate intake. And the whole principle of it is that you target these cancers and deprive it of glucose, which these cancers love. So by removing glucose from the system and by giving the tumors energy as only ketones, then it won't grow and it won't progress to a later stage of cancer. So that is the theory behind it, but then these have been done in animals and haven't been done in humans. There are a few case studies here and there, but not systematically evaluated in humans. So we are one of the groups that are going to be doing these kind of studies, but not yet. We're not there yet.
And we actually did have several people submit questions on Facebook asking if sugar really feeds cancer.
Yeah, that's one of the theories. Sugar does feed cancer, but then there are a lot of other things that happen along with sugar that also make cancers grow. So you can't pinpoint sugar as the only source of nutrition for the cancer. Cancers are very clever. They take your protein, they take your carbohydrate, and they take your fats. So they're not very specific. But what is one tumor that we think is specifically partial to glucose or sugars is the brain tumors. And I think we have a lot of promise there to target these brain tumors with diets like ketogenic diets, where you deprive the brain tumor of carbohydrates or sugars and don't allow it to grow. I think that's where the promise is. But all the other tumors are, they'll take anything and they'll actually fight the human body for the nutrients. And that's why you get syndromes like cachexia in a cancer patient, where they're depleted of muscle and fat because the tumor is like highly energetic and absorbing all the other nutrients that we are consuming.
We have another question from Facebook. This one is from Teresa. Teresa said that she's heard that she should be eating organic fruits and vegetables and she should be staying away from processed foods. Is this good advice?
Yes, it's very good advice. Processed foods are good in a way if it's lightly processed. For example, you can't make a whole grain bread without processing the wheat. But then you don't have to make something like processed cheese. That's a horrible food. So I would classify processed food into foods that need to be processed somewhat to be edible, because you can't eat whole grain wheat right off the wheat husk. So you have to do something to it. And that processing is okay. But then the processing where you change the nature of the food that you eat and you really process it with a lot of salt, you process it with a lot of fat, And these are the things that are dangerous, and that's what I would stay away from.
And our Facebook friend Linda is asking if there's any medical evidence of anti-cancer agents in soursop, and if so, what is the best way to prepare this type of fruit?
I think the fresher you consume this fruit, the better. Any sour fruit has a high content of vitamin C. So it's a superfruit. It comes under the superfruit group. And vitamin C is amazing. So it's an antioxidant, and it has a lot of good properties, towards health, not only cancer but other diseases too. So I would recommend that you eat it fresh. And if you're cooking it, stew it with the least amount of water, and then maybe it's too sour to eat it fresh.
Great advice. And you speak a lot about probiotics and prebiotics. What exactly are they, and how do they impact our health?
So I'll start with probiotics. Probiotics are thousands of microorganisms and bacteria that are in our system. It starts from the oral cavity down through our digestive tract. These are very important. Probiotic are this dynamic population of bacteria that are amazing for the human body. And what they do is they prevent these carcinogens or cancer-causing substances to be absorbed. So it retards the absorption of carcinogens. Number two, it also makes these phytochemicals that I've been talking about get absorbed better. So they absorb phytochemicals better. And number three, they also have this anti-inflammatory property. But they're like stars, like counting stars. There are millions of them in our human body, and it's important to keep them alive. So what keeps them alive are the prebiotics. Prebiotics are in nuts and whole grain and other fibrous foods that we consume. Nuts and whole grain are the major source of probiotics. What probiotics do is they make the bacteria, the prebiotics, make the probiotics thrive in our system. So it's important to consume these rich nuts and high fiber foods, as well as these probiotics, which are very rich in fermented foods like yogurts, kefir, and other products like fermented soy, like tofu and miso. So a combination of these every day in your diet is very critical to maintain good health.
And we want to remind everyone that we are taking your questions live, and we have a question from our Facebook fan, Sissy. She wants to know if there is any benefit to following a strict vegetarian diet for those who have advanced stages of cancer.
There hasn't been any evidence that vegetarianism or vegetarian diets really help the patient, increase their survival or increase their chance of getting the cancer again. But I would definitely recommend a predominant intake of plant foods, but also include the very valuable proteins in the diet. So I think including proteins that are important, because if you're post treatment for cancer, you probably have anemia, you probably have other deficits that you don't want to continue to have, and you want to have the best chance at survival and best chance at surviving well with an improved quality of life. So just eating vegetarian diet hasn't been shown to improve longevity or survival.
And Dr. Kumar is taking your Facebook questions live. Please leave your question in the comment section below. We want to remind everyone that she cannot make a personal diagnosis over social media, so we encourage you to call 1-888-MOFFAT or log on to moffitt.org to make an appointment if you are in need of medical attention. We have another Facebook question. This one comes to us from Alan. He says he's had a complete glossectomy and will be on a liquid diet for the rest of his life. He drinks a lot of Boost nutritional shakes and sometimes will blend in fruits and vegetables. Fortunately, the cancer has spread to one lung, and he is wondering if there's anything he can do in this complicated situation to improve his nutrition to help fight the cancer.
I think the best advice I would give Alan is to meet with a clinical dietitian who's working very closely with your oncologist, so that you can plan your meals the liquid meals, so that they're well balanced. Sometimes we have added pasteurized egg to the liquid diet. And I think eggs are incredible, edible, and they have these omega-3 fatty acids and other very high-quality proteins that are essential for cancer patients. This is something that we recommend to all our cancer patients. So maybe the clinical dietitian can give you very good advice on how to improve your selection, so you're not eating the same thing, or you're not consuming the liquid diet of the same composition every day. And I think the idea of adding the fruits and vegetables was great. I would add almond milk or cashew milk. These are prebiotics, nut milks. I would add the egg, but again, pasteurized egg, not a raw egg. So I think they can give you more ideas depending on how you feel after you've consumed these combinations.
And certain foods are rumored to cause cancer, from soy products to microwave popcorn and processed meats. Let's start with soy. What is the soy cancer link, and does it prevent cancer or does it cause cancer?
Soy is a very finicky kind of a subject to talk about. But soy has weak estrogenic properties, contains substances that have weak estrogenic properties, or weak hormonal estrogen hormone properties. So we think that people who have an ER sensitive or ER positive breast cancer, or have a family history of ER positive breast cancer, shouldn't be starting on soy products. It's not something that Americans eat in their daily diet, so I wouldn't recommend that you start it. But in our research, we also saw that men who have high testosteronic levels, which is the male hormone that drives certain types of prostate cancer, the estrogenic components of soy kind of weakens the testosterone levels. So I think in men, it may be a good idea to include 1 or 2 servings of soy a week. But don't start anything. This research is still in its infancy, and I wouldn't recommend that you start anything new. So I think it's different effects for different gender and different kinds of people. But I think it's overrated as of now, because the research is not very clear on soy.
We have another Facebook question. This one comes to us from John. He is wondering if there is a link between Diet Coke and cancer.
There is no link between Diet Coke and cancer. All these diet products are made with ingredients. It's not only Coke, but all the other beverages that are sold in the market. I think water is a good beverage. I don't know why one should be drinking diet anything which has 0 calories, 0 everything, and so does water. So I think water is my recommendation for the best beverage. If at all you should drink something other than that, caffeine, coffee is good. Just don't overdo it. And then, of course, green tea is an excellent beverage. We see a lot of promise with catechins in green tea that can potentially prevent progression of early stages of prostate cancer. So those are the beverages I recommend. I don't recommend any kind of soda. There's never a soda in my house.
And on to microwave popcorn. Does microwave popcorn cause cancer?
So microwave popcorn got a lot of bad press because the lining of the bags that are microwavable had some substances that were carcinogenic. There was also this fake butter flavoring that had some carcinogenic properties. But basically, these chemicals in these in popcorn shouldn't have been put there in the first place. People who worked in factories where they had a lot of these 2 chemicals, were at high risk for lung cancer. So why would you put that in a bag of popcorn that even kids may be eating? So last year in 2016, the FDA banned both the chemicals. So the current popcorn makers cannot use that in their bags. So it's gone. So we don't have to worry about that.
And we just celebrated the 4th of July, and many people enjoyed hot dogs and hamburgers on the grill. Now this is almost a double whammy because grilled foods and processed foods have both been linked to cancer. Our Facebook friend Sarah is wondering if char-grilled foods really cause cancer.
Yes, high-fat char-grilled foods do have a substance that is carcinogenic. But you have to eat a lot of it, and almost on an everyday basis to get the bad effects of char-grilled hamburger. And I think that's where I talk about moderation. I mean, if you're doing that only on July 4th and Memorial Day, that's twice a year, eating bad food like char-grilled hamburger or hot dogs, go ahead. But just make sure even the hot dog that you buy is of a good quality, because there are some good manufacturers of hot dogs that don't use as much crazy stuff in it as they used to use before. So, I mean, if you're doing it twice a year, I give it a pass.
And cancer patients often experience weight loss as a side effect of treatment. And our Facebook fan, Deborah, wants to know if there are any particular foods that will help her put weight on.
So this again is a major issue with cancer patients, because they have mouth sores, they have taste alterations, they have loss of appetite, period, and also a lot of inflammatory cytokines in their body that are causing their weight loss. I mean, it's not resolved in some conditions like cachexia, which I talked about earlier. Refeeding doesn't resolve the body shape or the lean body mass that they once had. So it's very important to work very closely with your clinical nutritionist and your medical oncologist to see what the etiology of this weight loss is, and then work on a diet regimen along with appetite stimulants. We have 3 or 4 appetite stimulants that we can give you that, when given with the diet, can improve your appetite and make you eat better. But in general, my rule of thumb is eat what you like. Don't worry about what you liked before, what was your favorite food before, and try to eat those. Because if you throw up because you have nausea related to a chemotherapy, then you're not going to eat that food again. That favorite food is not going to be a favorite food anymore. So hold off on the things you love to eat and just go by your instincts, go by your cravings. What are you craving to eat, and what feels good to you to eat? Eat those foods for that temporary period while on treatment, and post-treatment you can then start introducing the foods you love to eat and you enjoy eating.
And our Facebook friend Karen asks, if triple-negative breast cancer is not related to estrogen, what kind of diet do you recommend to prevent recurrence? And is there any truth to glutamine or meat and cheeses affecting recurrence?
So that's a double question, two-part question. So the first question is triple-negative cancers. Triple-negative cancers are predominantly genetically based cancers or derived cancers. So these cancers are difficult to treat, but what we are recommending is the same things that we are recommending for preventing cancer. The high intake of fruits and vegetables, or high plant-based diets with quality proteins, because you need those proteins in your diet, from lean meats and eggs that contain omega-3 fatty acids, the prebiotic, probiotic, and surveillance. Make sure you're screened periodically to make sure that you're not recurring. And so families of patients who have triple-negative cancers are also a group of people that are at high risk. So we make the same set of recommendations to that group of people also. And I always say, be obsessive about what you're eating and what you're doing if you are a high risk for these cancers, especially the genetic cancers. And also the other thing I want to mention is food safety is important. I mean, washing your, and especially for the cancer patient population, it's important to wash your vegetables, wash your fruits and don't eat out. When you're eating out, make sure you don't eat prepared foods. like salads and things like that. So that's something that patients should be thinking about.
And our Facebook friend Colleen asks if there are any specific supplements that should be included with an immunotherapy treatment plan for cancer patients.
Okay, so supplements meaning vitamins, minerals, or other supplements, right? So the American Society of Clinical Oncology doesn't recommend any supplements of vitamins, minerals, or any herbal supplements during treatment, whether it's chemotherapy, radiation therapy, or immunotherapy. Because the whole goal in cancer treatment is to to really attack the cancer cells that are very potent and highly energized and are grabbing all the nutrients, like I said. So you don't want to interfere in that treatment. And there's also a lot of toxicities that occur during treatment. And taking these vitamins and minerals and herbal supplements that we don't know what the source is or whether they really contain what they say they contain may interfere with these treatment regimens, which are all novel now. They're still new, and the combinations that they are giving patients are also new. So it's important to stay away from that and not cause any more interference or any more adverse events to what is already occurring during cancer treatment. So I think the best advice to give is to stop taking any supplements. And if you're taking any supplements, show it, especially vitamins and minerals, show it to your medical oncologist who's treating you and make sure they approve of that supplement.
We want to remind everyone that Dr. Kumar is taking your questions live via Facebook. Please leave your question in the comments section below. We have another question from our Facebook friend, Jeannie. She wants to know if she is a current patient, how would she go about scheduling an appointment with a nutritionist at Moffitt to discuss meal plans?
So all you have to do is tell your medical oncologist that you want to see a nutritionist. We have several of them at the cancer center, at the Moffitt Cancer Center, and they will just call them up for you and they would let them talk to you about what your needs are and how we can meet your needs.
And we want to remind everyone that that phone number is 1-888-MOFFIT. And we've spoken a lot about foods that may cause cancer and foods that may be beneficial to overall health. But we spoke a little bit about nutrition for patients who are currently undergoing cancer treatment. Now, many cancer patients receiving treatment may experience, as we discussed, loss of appetite, while also mouth sores, or notice that food they enjoyed now tastes bland or unappealing. What advice do you have for someone? What should they be eating while undergoing cancer treatments?
So this is a very challenging time for the cancer patient during treatment, because there's a lot of unanticipated things that are happening to you, because there are taste alterations, nothing tastes right, there's a nausea, there's vomiting. I mean, although we pre-treat for vomiting and nausea, there are still patients who experience that. So I would recommend a no rules, no bar kind of a diet, in the sense, go with your gut, make sure you drink enough water and make sure the water is from a good source. Make sure you drink and eat what you feel like eating, and not depend on the foods you loved before, as I said. So I think it's just as needed basis. You make sure you eat the foods that taste good to you. And the other thing I would highly recommend, and I said that already, talk to your nutritionist. We can give you some very good ideas. We've done this before. We've seen patients like you before. We know what patients like, what they don't like, and we can give you some ideas. And we can also give you some supplements. If your nutritional intake is inadequate and what you love at that time is inadequate, we can include appetite stimulants. We can include supplemental feedings. It doesn't have to be just Boost. There are other supplements that we can give you that may taste good to you. We'll try various supplements, and depending on what's good to your taste, that's what we will introduce to you. And then you can always add other things. You can add yogurts, you can add other kinds of milk that I've talked about that may taste good and that you may tolerate better. So I think there are a lot of options that nutritionists can give you during this very challenging time.
And our Facebook fan, Rocio, is a triple negative breast cancer patient and wants to know if there are any foods she should avoid eating.
I think the list, as I said, the fresher, the more wholesome the foods are, the better. Stay away from the processed foods, the highly processed foods, the very salty, high fat, that kind of processed foods, and also prepared meats. That's something that I would stay away from also. Again, even in cold cuts and prepared meats like deli meats, they're of better quality these days. But I would still do a better ratio of wholesome, fresh foods than these kind of processed, ready-made foods. Then again, I think to be very cautious about going back to getting screened for any kind of a recurrence, or if you're a family of a member of a triple negative patient, just be more aware of catching this disease early.
And our Facebook friend Rita wants to know if there's a preference for low-fat versus low-carb diets for postmenopausal women with a history of breast cancer.
I think just watching the calories, both from fat and carbs, is important, because a high-carb diet, eventually, the higher the carb gets converted to fat, because the body's depot of storage calories is in the form of fat. Some in the form of carbohydrates, but mostly in the form of fat. And I think just a balanced diet is important. A low fat or a low carb doesn't work one way or the other, except if the entire diet is well balanced.
And we have another Facebook question. This one is from Marcelo. He wants to know if high fiber food can prevent colon cancer.
Yes, there has been a lot of work done on looking at high fiber foods, especially with both soluble fiber as well as insoluble fiber. And soluble fiber comes from fruits and vegetables, and insoluble fiber comes from wheat grain and other whole grain foods. And the mechanism by which this can actually impact risk of colon cancer is that it changes the bile acids in the colon and doesn't allow or the pH of the bile acids in the colon, and doesn't allow these bile acids to impact the lining of the colon, and thus can prevent colon cancer. There are two things someone at high risk, familial high risk of colon cancer can do: eat a high fiber diet, as we talked about. And the second thing is physical activity. Just 45 minutes of walking every day can also help in the reduction of colon cancer risk in this high risk population.
And these days, it seems like everybody is on a gluten-free diet. What is gluten, and should we be eating it or should we be avoiding it?
So gluten has really gotten a bad rap. Gluten is a carrier protein, in the sense it's kind of a storage protein, and it's present in high levels in wheat and in barley and in some of the other grains, but not commonly eaten. But people think that if they eat a gluten-free diet, that they will actually lose weight or they're doing better. But there's really no evidence of that. The only people who have to avoid gluten are those people who have an allergy or an intolerance to gluten, and they are. It's a syndrome. It's a disease called. It's actually a syndrome called celiac disease. So this is diagnosed very early in life, maybe in childhood, between 1 and 4 years old. And 1% of the world population has celiac disease. So only those people have to avoid gluten because they're sensitive to gluten, because their small intestines are not made to absorb gluten. So they'll have a very harsh reaction if they eat gluten. But the rest of the world, there's no evidence that gluten-free diet really helps in any way.
Our Facebook friend Rocio says she suffers from chemo brain and body pain as a side effect from chemotherapy treatment. She wants to avoid painkillers and is wondering if there are any natural remedies.
So there are really no natural remedies that are in the market yet. But for chemo brain, there are a few things that we can recommend. One is some interactive games that you can play. interactive word games or brain games that you can play on the computer. That helps to some extent. A 45-minute to an hour physical activity, exercise, helps this patient population. And one of the studies that we're doing, targeting women who have chemo brain, who are really coming out of breast cancer chemotherapy, is a combination of blueberry anthocyanins and omega-3 fatty acids. We developed a drug with these two substances, but you can just eat until we finish the studies and show actual evidence that this works. Our studies are still in progress. So yeah, I would recommend including these kind of anti-inflammatory foods in naturally occurring in eggs, seafood. The redder the seafood, the higher the content of omega-3 fatty acids, and the same thing, blueberries, cherries, strawberries. They all are rich in the substance called anthocyanins, which is a phytochemical that has antioxidant properties. So combining these kind of activities may help chemo brain, but the pain is is a real challenge, and I feel sorry that we don't have anything natural other than what the doctors can prescribe.
And about a year ago, pulling coconut oil was all the rage. This is where you put coconut oil in your mouth for several minutes, and it's supposed to pull the toxins from your body. Part of this story that went viral on social media also insinuated that coconut oil could cure colon cancer. Now, first of all, could you tell us a little bit about the nutritional value of coconut oil and pulling, and is this the cancer cure we've been searching for?
Not at all. I mean, this is great. I mean, this is kind of a crazy issue that I probably have a serious bias towards. First of all, coconut is another fat. It's a fat that we've been around for a long time, and probably the gargling of coconut in your mouth to take out the toxins, because the toxins don't live just in your mouth. They're all over the body again. So first of all, this is an Ayurvedic practice, an old medicinal practice that was there when we didn't have fluoride toothpaste, fluoride mouthwashes, or water picks and flosses. So really, that's the time they were using coconut gargles. But there is really no evidence at all. I've looked up and down to search for good randomized clinical trials, or any clinical trial for that matter. There is nothing out there that shows it can do anything other than it's another fat. There's really nothing to it.
And our Facebook friend Kim wants to know if sweeteners such as agave nectar and stevia are good alternatives to sugar, or are they bad for promoting the growth of tumors, specifically in the lung? There again, there's no evidence of that. If that tastes good to you as a sugar substitute, then you can take it. But I hope people are not using a lot of sugar substitutes such as those, because there is really no studies done on whether it can increase or decrease the risk of cancer. It can just lower the caloric intake of sugars, especially if someone's using 6 teaspoons of sugar in their tea. It's best to use a sugar substitute. But otherwise, if you're just using 1 or 2 teaspoons of sugar, it's just 16 calories per teaspoon. And if you can, kind of mix your coffee a little brisker, or walk, faster to your desk or something, you kind of lose those 16 calories. You can work out those 16 calories. So I mean, to me, sugar substitutes are only for those people who take a lot of sugar in their with their beverages. And how about bacon? Can bacon be a part of a healthy diet?
Bacon is not even a part of any food group, for that matter. I mean, people don't like me saying this, but it shouldn't be in any of the food groups, and it shouldn't be in a part of anyone's meal, because it is just a piece of saturated fat that's cured and is processed to the hilt. So it's really one of the bad foods that we've been talking about. So that's not even in my vocabulary.
And I've heard you say recently, we're going to move on to exercise, and I've heard you say recently that we eat 7 days a week, so we should be exercising 7 days a week.
Exactly.
What advice do you have for someone who's just beginning a new exercise routine?
So if you're beginning a new exercise routine, I would say we are not Homo sedentarians, we are Homo sapiens, which means we were made to move around. So exercise has become this concept, that we have to do every day. But in reality, we do eat every day. So to be functioning well and to be fit and to be healthy, including a 45-minute to a 1-hour exercise regimen every day, even if it's a matter of just walking every day, or if it's a matter of including some strengthening exercises as well as walking, are important to do, and some stretching. So a combination of yoga, stretching, which includes stretching, some kind of stair climbing, and walking 60 minutes a day purposefully can really contribute to better health, better fitness level, reduce your risk of several of the other diseases, and make you feel wonderful. And if you're just starting anew, maybe you should start 30 minutes and then go to 45 minutes in an hour. But just start slowly and make sure you're capable of doing that. I think everyone's capable of walking, or most of us are. So that's something you can start with easily.
And oftentimes when we exercise, we may think we're burning off more calories than we really are, and some people may use exercise as an excuse to eat more junk food. How should people adjust their caloric intake for the exercise and the calories they're burning?
Really, to resort to junk food just because you're exercising, you should be walking to Minnesota to do that. So from Florida to Minnesota, I mean. So I think that it's not a good bargain. I think if you're doing exercise is a part of living healthy. Exercising is a part of living healthy. I mean, if you're eating well, and like we talked about, and you're including this exercise regimen in your daily activity, I think that should balance and give you a very good prospect of living a very healthy life. So I don't think it's a good substitute for exercise. I mean, eating badly.
And what advice do you have for people who are currently undergoing cancer treatment to exercise or to begin an exercise program?
We have seen there's a lot of research coming out that when patients experience fatigue, when patients experience this kind of a weight loss where they're losing muscle, all this can improve with exercise. Even cognitive impairment, or the chemo brain we talked about, can improve with exercise. So we are seeing more and more studies that are evolving that are showing the benefits of exercise. And this doesn't mean buying a new exercise equipment or joining an expensive gym. It just means purposeful walking for 45 minutes and listening to your favorite music, or enjoying the walk rather than making that a burden to your daily routine.
And how should people adjust their caloric intake if they're training for a marathon or doing some other type of endurance sport?
So training for a marathon or an endurance sport requires extra calories, and also it requires them to store additional calories for their marathon. So many of these people actually take a lot of protein supplements to kind of rectify the protein loss that occurs during the training period. What we are seeing now is if they also, other than the protein supplements that they take and the caloric intake by means of complex carbohydrates that they take, they can also add these anti-inflammatory foods like the omega-3 fatty acids and the blueberry anthocyanins or the other berry anthocyanins. We have a collaborator in Norway where they are preparing a drink for their Olympic athletes, especially their soccer players, where they not only have a protein supplement, but they've also added omega-3 fatty acids and anthocyanins in it. And they find that the protein and the anti-inflammatory food combination makes them recover faster for their next game. And that's an endurance sport where it's very fast and where there's a lot of energy expended. So I think adding these anti-inflammatory foods along with the protein is a better combination that may work better than just adding the protein and the carbs.
Great advice, and we've gone over a lot of information today. What final thoughts or final words do you have for our Facebook fans?
I think it's important to not only eat better. We've talked about the fruits and vegetable intake. Before, the recommendation was 5 a day. I recommend 10 a day, only because if you're drinking a glass of orange juice, that's about 3 servings of oranges. So I think it's easy to do that. But if you're not doing that at all, start slowly. Including the prebiotics and the probiotics are important. The prebiotics from whole grain and nuts, and probiotics from fermented foods like yogurt and kefir and other fermented products. And the third recommendation is to improve your quality of protein. The proteins of quality are the foods that contain these omega-3 fatty acids, which are considered anti-inflammatory currently. And this is something that you need on a day-to-day basis. So proteins, lean proteins of high quality that have these omega-3 fatty acids are important. And my fourth recommendation is to improve your physical fitness, and that is by increasing your physical activity to a minimum of 45 minutes a day, increasing and working up to an hour a day. This should be almost a must. And last but not least, we know for a fact that if you catch a cancer early, you have the best chance at survival or the best chance for treatment. And we talk about heart disease and diabetes and other things. They're also not curable. We treat and we manage these chronic diseases. Cancer is going to be a chronic disease if you catch it early. So I would say get yourself screened for cancers. You can screen for prostate, you can screen for colorectal, you can screen for breast cancer. Why not? And if there's a vaccine for a cancer, why not get that? There are several vaccines that are in experimental phase, but there's HPV vaccine for cervical cancer prevention. So these are things that can be done by you, and don't wait for any other person to tell you what to do. I think take it by the horns and go ahead and do these things that can actually prevent these cancers.
Great advice, and thank you so much for joining us
Thank
today,
you.
Dr. Kumar.
Thank you for having me.
Thank you for sending in your fitness and nutrition questions. Be sure to log on to moffitt.org/take charge to get healthy recipes and learn more about nutrition and cancer.